Hi, I am Dr. Naveen Kumar Dhagudu, Senior Consultant Psychiatrist in Yashoda Hospital, High Tech City. Today, autism condition we can able to discuss. So, autism we usually seen in the childhood psychiatrical condition. It's a neurodevelopmental disorder. We usually seen 4 times more in the boys when compared to girl children. This autism, we can able to say autism spectrum condition. So it encompasses the both Asperger's syndrome, Rett syndrome, even classical Kanner syndrome. So these are all we group into the autism spectrum condition. What is the clinical features about this autism condition? Parents usually identified their children with having of autism. Usually it happen lesser than the 2 years age onwards. They can able to pick up with the common symptoms like child is not responding by his name and child is not having of the understanding the facial expression about the father or parents, even the responsible other adults in the family. The child is getting the difficulty in understanding the aspects about how the social behavior is required, and social interaction is becoming more odd in the social situations. And there is certain pattern behavior also able to find out, like the person, especially child, is frequently showing the finger flapping movements, swirling movements, turning around without able to hear the other person's commands. So he is constantly move on that, and circumscribed interest and having a very specified food patterns and some sort of the high sensitive to the light, sound, music. So he is easily get into the sensitized, he easily get into the anxiety in terms of while taking the food, while he is hearing the words and sounds which is annoying for him. And his learning pattern also very peculiarly happen. So he is finding the difficulty in the social encounters like a school, aspects of the while group play. So they are finding the difficulty in forming a long lasting friend circle also. So with these complaints, usually parents may come to reach to the doctor. So do you know that what is the risk factor for the autism? So usually we believe that it's a idiopathic, means the exact cause is not known, but majority of the time environmental factors and birth related events, especially like a birth asphyxia, preterm labor, and having of the hormonal intervention for the pregnancies, and as well as the birth complications. So even the early childhood negative events may happen. So these are all also can possible, and infections also, last but not least. And so these things, once you identified, as a hope for the treatment's sake, there is no single test we can able to say this autism will be the diagnostically proved by this test. So is a clinical diagnosis. This entity is we can able to understand the child's ability to learn and ability to adjust in a peculiar manner. So this is the neurodevelopmental issue. There we need to give the therapies and management which improves the ability of learning of their skills and communication. So what is the main treatment modalities here? Here the child understanding about that educational therapies in terms of how the way the child is learning. We have to give the stress-free and sensitivity-free of the environment here. And second thing is the social behavioral and communication therapies we have to practice. So make the principles of the cognitive behavioral therapy principles we can able to apply here and understand the child corresponding connection between the feelings and thoughts and behavior. So by the way, child's behavior will be more understood by the parents, and they will be guide their children in appropriate manner. And some sort of the dietary suggestions. There is no specific diet for the autism, but wherever the possible, gluten-free and as well as casein-free diets will be advocated. And balanced diet is also very important. So whenever the comorbid condition like anxiety, hyperactivity behavior, even substance behavior. So whenever the comorbid conditions are there, we have to treat appropriately and age-appropriate manner. And appropriate psychosocial interventions and therapies are very much essential for the long run to increasing their ability to learn about their skills and as well as communication. Thank you.